Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 236,841 confirmed cases of COVID-19 in Canada and 76,707 cases in Ontario. Chatham-Kent has 410 cases and Sarnia-Lambton has reported 372 cases. Michigan now has 178,180 cases, with 15,652 cases being in Detroit. Today, we are reporting 22 new cases of COVID-19 in Windsor and Essex County. 4 are healthcare workers, 3 are local healthcare workers, and 1 is in Michigan. 3 people are residents of long-term care and retirement homes. 3 people are close contacts of confirmed cases. 3 are community acquired, and 9 are still being investigated at this time. We have had 2,864 cases since March. 2,711 cases are now resolved, and 77 cases are active and being followed by our health unit. 2 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently 2 long-term care and retirement homes experiencing a COVID outbreak. And while we do have cases in schools, we do not have any outbreaks in schools. We are currently in orange alert. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep a 2 meters distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2 meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centers, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. November is officially Radon Awareness Month in Canada. Radon is an odorless, colorless, and tasteless gas that enters our homes through cracks and drains in the foundation. Long-term exposure to radon is the 2nd leading cause of lung cancer after smoking. We are reminding homeowners of the importance of testing your home to know your level of radon gas. You can purchase a 91-day long-term test kit online or at your local hardware store, or visit any Essex County Public Library branch and borrow a digital short-term testing device. A short-term device can act as a screening tool to help you determine if long-term testing is needed. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us this morning. Over the weekend, we reported 10 cases on Saturday and 7 cases on Sunday. As Teresa mentioned, we are reporting 22 new cases today in our region. In addition, last week we reported more than 5 cases few times as well, raising the concern that the disease is spreading in the community more than we like to see. Individually, we always have a choice on what we do and how we interact with everyone else in our community to keep ourselves safe or engage in any of the high-risk activity that many people are doing. When it comes to any risk to the community, we all share that responsibility. We, each one of us, have the opportunity to change our destiny and change the destiny for our region. We can keep our community safe by paying attention to everything we are doing as individuals, as businesses, and keep everyone safe. The rising case count is definitely a concern for our community. The cases do not increase one by one to get us to the red status. It changes exponentially. And most importantly, it is a delicate balance between cases everywhere, and one case in one sector can potentially tip cases to the other areas as well. For example, if you have more cases in the community, and let's say some of these cases would be working before they get sick and expose other colleagues at workplace. This could lead to an outbreak at the workplace with many other contacts potentially leading to work stoppage. My advice for the workplace is to ensure that you have strong screening practices and IPAC practices measures in place to keep everyone safe and keep your businesses open. Imagine the same set of some of these cases have a loved one in one of the long-term care home or retirement home, and they may have visited the long-term care home or retirement home before they notice their symptoms or before they get sick. This could lead to an outbreak at these facilities. We already reported 2 long-term care home and in COVID outbreaks in our region, and the advice for anyone who's visiting these facilities and also for the long-term care home is to ensure that you are following all your protocols and prevent any lapse in IPAC measures. Review, and review again to ensure that there is no breach. As frustrating as it sounds, but this is something that we all must do to keep our vulnerable safe in our community. Same example, some of these cases have another family members who a child may be attending schools in person, using school transit, and could expose everyone at school or at the bus. And in this situation, it could easily lead to an outbreak in the school and a wide range of people, children exposed, and leading to a large number of cases. Advice for parents: please monitor your child for any symptoms and do not send them school if they're showing any symptoms or if they were engaged in any high-risk activity. Advice for the school is obviously to keep everyone safe and follow all those practices, protocols that we have been advising, and that is in its place to keep everyone safe. We all need to act together to keep everyone safe, as this is a delicate balance from one area to another, and even though some individuals who may not develop any severe symptoms or experience any hospitalization or ICU need, but because of the delicate balance of all these factors that come into play, the long-term care home, the schools, our vulnerable population, our restaurants, our businesses, our farms, everything can be immediately changed if we lose our guard. The numbers, as I mentioned, it won't change slowly. What you're seeing right now, 5, 6, 8, 10, and today a spike, it can easily turn into something which could be very easily unmanageable by everyone, whether we are talking about our public health system, whether we are talking about the acute care health system, or whether we are talking about our community in general, potentially leading to closures, shutdown, restrictions, setting up on all those businesses and all those places. So we all have to do our part to keep our community safe. It is our responsibility. Every one of us, each one of us have to do our part to keep our community safe. What I can tell you is the time to act now when we are in the orange status. Once we are in the red status, the time to act would be too late. So right now, as individuals, this is our responsibility. This is what we need to do to make sure that we are constantly reviewing everything that we are doing. We are paying attention to everything we're doing. And I know, as frustrating and as boring as it sounds, because we've been doing this for so long, some of us more than the others, but it is absolutely critical that especially those who are maybe not thinking about it that much, pay attention to everything that you're doing. We cannot let this trend continue. We cannot let this change at all for our community. We have to keep our community open. We have to keep our community safe. And I urge you in the end, I request you, please update your own protocol, everything that you're doing. Pay attention to what you're doing and keep yourself safe. Keep our community safe. Well, in the end, all I can say is that's the only way we can keep our community open, our businesses open, and keep our vulnerable safe and everyone safe in our community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Is there any questions from AM 800?
Dr. Ahmed, I know a couple of my colleagues on this call asked this question recently, but just seeing the numbers, I know 22 is high today. We saw single digits the past couple of days. But with 22, are you concerned that our numbers could be rising here and obviously could be a hotspot like the GTA, Ottawa? Is that your concern? Obviously, you don't want to see us to become a hotspot but with the numbers increasing. Is that your gut feeling?
Yeah, and that's what scares me mostly, because what we are seeing in these 22 cases, and as Teresa gave you a breakdown, it basically includes everything. We have one from a travel related, we have individuals who are in healthcare, we have cases in the long-term care home, we have a case in the school, and we have cases that are community spread, which we cannot link it back to anyone else. So all those indicators are a stark reminder that how delicate all of this balance is. Last time when we reported, I think close to 16, 17 cases last week or the week before, the good thing or the bad thing, however we want to see it, is a lot of them were close contacts of a confirmed case. They were all, most of them were part of a single household. So that way it was contained. When we're reporting 22 today with all these diverse places, it scares me. It gives me the indication that we are lagging in what we are doing, and we have to act now. We cannot be like what we have seen in other places and where we were in the summer. And the sooner we act, take action, everyone, each one of us, only that's way we can save it. So yes, it's a concern, and that's why I wanted to give that a reminder as well, that the cases will not increase one at a time. It will just increase exponentially, and once it spreads, it's difficult to contain, and we have seen that. We have had that experience. So I think we have to act right now before it's too late.
Is this week and early next week, they're obviously going to be big weeks as well with Halloween over the weekend. I guess if the numbers increase, and who knows if people didn't follow your advice, Teresa's advice, others' advice in regards to Halloween, we could see another, boost in numbers.
Well, I really hope that we don't, but yes, this is something in addition that we will have to closely monitor. And whatever we are seeing right now, even with the case count that we reported today, we'll have to see how it translates into an overall trend. We reported a few days last week with case counts of more than 5, which is, again, it's something that we don't like to see. But in the next couple of weeks, I think those would be really crucial to see where we land. And if we act right now, and again, as I keep reminding, the time to act is when you have the ability to contain it as individuals. So we need to do that. And as I mentioned, even for the businesses and everyone else, I keep reminding, it's time to stay on top of things, to make sure that you're not doing anything that could put your employees or anyone else at risk. So it's everyone's responsibility, and we have to do it. It's really, really critical that we keep that way.
I guess, sorry, one more here. When you, woke up this morning, you saw the numbers, just your initial reaction, personal reaction on your end?
Well, unfortunately, some of these numbers we were dealing with late yesterday as well, because our team was trying to get in touch with many of these cases. So it was not this morning, but yes, the moment I saw that number, my first reaction, and it happens all the time, if Teresa sees that first, she calls me, we talk, and then we just try to just understand what does it mean and how bad it can get. So that's usually our way of dealing with what we see in our community. But both of us, we were feeling exactly the same, that, oh my God, like that was my initial reaction. Oh my God, like what are we seeing here? And I think we have to take it seriously before it's too late.
Thank you.
Any questions from CBC?
Yes. Hi, Doctor. As far as you know, any of these new positive cases, do you know if any of them might have attended that anti-lockdown protest, the large one where people weren't following protocols that we saw just over a week ago?
Not that we can link it to, and who knows if they went, whether they will report it back to us or not. So again, I don't want to assume that, but to answer your question, no, we don't have any information that we can link it.
And just another question, how do you think Halloween went in Windsor-Essex with respect to following public health protocols and making sure we're containing the spread? Do you think the region did a good job?
Honestly, I don't know if Teresa may want to comment on it. I didn't go outside, so I have no idea what was happening. The only thing that I maybe after this pandemic, what I noticed is people decorated their houses, which is good. I think maybe that's a good thing. But we don't know how that translated into the traffic, the children coming in from door to door. So I can't really comment on it. And I don't know if Teresa has any comment on it.
This same as Dr. Ahmed. I was very careful. I have a mother that I am always concerned about because she is elderly and is vulnerable. So I wanted to make sure she was safe. So she came to our house and we did not give out anything. But we know that neighbors did, and they did it safely. So what we're seeing is that people were creative, that our messaging has been out there, and that for the most part, what we have heard is that people tried their best to celebrate Halloween safely. The bigger concerns are home parties, so we'll see in a couple of weeks how that translates into the numbers.
Thank you.
Any questions from Blackburn?
Sorry, excuse me. You did mention it at the beginning, but we've seen a few school cases. Just tell me how that the handling of those cases has been going, and what you're keeping an eye on now that you have a few cases in the schools.
So from the very beginning, we have worked with the schools to have protocols in place and procedures. So as cases are identified on the weekend, we work with the school boards and the school principals during that time to try to notify parents so that students aren't returning to school if they've deemed to be a high-risk contact and need to stay home. So overall, I think it is going well. I think our school board partners have been amazing, and with their help, we continue to address things as quickly as we can and protect the students, the teachers, and any high-risk contacts. So I think it's going well in a pandemic. And as I stated, we do have I believe 3 schools with cases, but no outbreaks, no outbreaks identified in schools where there's a link in the school setting. So that's all very, very good as well.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Can you speak a bit more about why it's more concerning that the cases we're seeing today are spread out over multiple sectors, multiple transmission points, rather than one close contact with maybe a large household infecting all of those people?
Yeah, so it's when we're talking about all these public health measures and some of these recommendations going back all the way since the beginning of this pandemic. So if you recall what used to happen in the first phase of pandemic, you had widespread closures. We are basically asking people to stay home and do not go outside unless it's for essential reason. And for all of those measures, the purpose behind was that to keep the number of close contacts minimum and keep everything, because there were a lot of protocols that were in development, and not businesses and other places were not ready to cope with the demands for IPAC measures for COVID. So all of those measures were not there, despite we have seen a number of cases at that time. What we are seeing right now is a totally changed world compared to what we had in, let's say, April or May, when the lockdown was in place. So right now, mostly all of these businesses are open right now, like with the exception of very, very few. Most of these businesses are operating, maybe not the way they like to, but they are operating, they are in the businesses. So people are going outside for jobs, for doing work to maintain their economic activities. And also there are social activities, social gatherings that are also happening. None of these was happening or happening at a much, much lower scale back in April, May. And when you factor all of that in, and now when you're seeing the cases, so one case, let's say back in those times, could potentially expose to a very few number of people and was able to contain. Right now, when if something similar happened in this time around, the same individual, and we talked about it, about the number of contacts. I think I made a presentation last Wednesday. We talked about one individual and a single household, and if let's say if that person is working, just the risks where all these risks could translate into. It could have a translated risk at the workplace. It could that person could go to any restaurants, grocery stores, gym, and could potentially expose people there. That person may have a family member who can also maybe working, and then that family member, if they got infected and if they are spreading it to someone else, and if the same family members, if they have little children and if they are going to schools. So you can easily imagine the complexity of how a single case could lead to many cases compared to what we were seeing in the first wave. So the 22 cases today, it's somewhat a similar reflection. So we have cases that we have seen in the long-term care home, we have cases that we have seen in the school setting, we have cases that we have seen in the community setting, and then we have seen cases that are a result of a close contact. So all of those are a reminder that the magnitude or the exponential change that we can see, it can be a huge impact for any of our community. So right now, even though when we are in the orange status or medium risk status, that's where I think the opportunity is there to change the course. So the course that we are heading is obviously, it can lead to a dangerous path before we get to the point of saying we are in the closed or we're in the red or a high risk zone. We need to shut down. We need to take action to contain it. We don't want to get there. Nobody wants to go there. So I think it is important for all of us to follow some of those best practices that's been out there. We've been talking about it every day, and as frustrating and as boring it sounds, that's the only way we can keep everything safe. So this type of complexities, these type of cases, when we are seeing, it really scares me, and we need to communicate the risk very clearly to the public, that where we are right now and where we could go. So time to act is right now, and we hope that everyone really gets this message and everyone start to do their part, whether you're an individual, whether you are a business, whether you are a workplace. Everyone, review your practices, review your protocols, make sure that you're not missing anything, and continuously improve it. That's the way we can keep our sanity, keep everything open, keep our economic, social, mental well-being all intact.
Thank you.
Any further questions from AM 800?
Teresa, I'm not sure if you have this today. If not, can we get it tomorrow? But just wondering, has there been any additional fines issued by the health unit? I know back in mid-October there was one at the convenience store. Just wondering if there have been any additional. Like I said, if you don't have it in front of you today, can we get it tomorrow?
I will double check for tomorrow, but I believe there is one additional charge, but I will confirm that for tomorrow.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
And Windsor Star?
No, thank you.
Okay, thank you, everyone.
Bye.
Thank you.
Bye, thank you.